Dr. Morse here again. I want to thank you all for viewing our videos, and I appreciate your questions. One of the most commonly asked questions is the word diabetes. And as you know, there's considered two types of diabetes, type 1 and type 2. So I'm going to discuss those and show you how to find a remedy or a cure to these, because diabetes is easy to cure. But I want to first remind you about the word diseases. Medical doctors commonly use these concepts to confuse the patient. They use these concepts, and most endocrinologists consider diabetes as an autoimmune problem. There's no such thing as an autoimmune problem. No such thing. Doesn't exist. So we're going to discuss today what causes blood sugar problems, both hypo, hyper, and the two types of hyperglycemia, which is diabetes. And it's important that you review the 4-part series on the great lymphatic system, what causes diseases, because it's important for you to understand the lymphatic system and the two sides of chemistry. Because except for genetic memories, how you weaken the cells of your body is through the two major fluids that control the health of them. And remember, these two fluids that control the health of your cells is the blood, which is the kitchen, and then you have the sewer fluids, the lymphatic system. When you look around where all your cells are, and that's your muscles, your bones, your liver, your heart, your kidneys, your prostate, your ovaries or uterus, it doesn't matter what tissue, your brain, skin, it's all just a bunch of cells. And two fluids invade most cells, flow around the cells. These are called interstitial fluids, simply the fluids that flow around cells. Remember, cells can't get up and go to the kitchen, and your cells can't get up and use the bathroom. That must be supplied on site. And because of that, cells live on this river of fluids, the interstitial fluids. 75% lymph, 25% blood. So the lymph system, of course, deals with the corrosive side of chemistry, that which is called acids. And then your blood deals with base chemistry predominantly. That's the healing side of chemistry. So it's important to understand the causative effects of why cells break down. And that way I don't have to add this to every video, and you'll get a good understanding, this core understanding how your body works, very simplistically. And if you understand that, you will have the foundation for all problems that you might experience. It's just location, location, location. So let's take a look at hypoglycemia and hyperglycemia, which is diabetes type 2. And we'll use the word diabetes, but keep in mind, this is simply a blood sugar problem. And diabetes type 2, which is the blood sugar problems, and type 1, hypoglycemia, these are sugar metabolism problems. You don't metabolize your sugars properly. And there are glands in your body, and we've discussed these previously, that the endocrine glands in your bodies controls everything that goes on here. And so, important to understand the adrenal glands that sit on top of the kidneys, which the kidneys control, or are the great eliminative organs of this gigantic sewer system that deals with acid waste from cells. This is where you see all the cancers. This is where you see all the inflammation, all the itises, all the arthurs and the gastritises and colitis and cystitises and lupus and all these type of things. This is a system that causes fibrocystic problems, fibromyalgia. You go right down a long line, different names for the same problem. And easy to find remedy to these, tell you the truth. People suffer because medical doctors treat symptoms, and they go after bacteria, which is simply there working to clean your sewer system for you. Stupid, insane kind of thinking. So understanding the role of the adrenal glands on top of the kidneys, incredible glands. I'd get a book on anatomy and physiology and read about your adrenal glands. Real simple, little walnut-shaped glands, almost like a pyramid on top of each kidney. They partly make your neurotransmitters that runs your autonomic nervous system. And we're going to talk about this when we get into type 1 diabetes, the autonomic nervous system. That's your sympathetic, parasympathetic. That's this nervous system. That's the automatic nervous system. When you breathe, you don't think about it. Your heart pumps, you don't think about it. Your bowel moves, peristalsis. All this is the autonomic nervous system. If I suppress that system in you, you're going to think to breathe because you'll stop breathing. That's where you see all these children with all these neurological weaknesses from genetics. They go under surgery, and they come out and they can't breathe anymore. Think of Michael Jackson, propofol. These are neurotoxins. It's estimated that 20% of people that go under the knife in surgeries don't come out from the anesthetics, from anesthesia. And that's because that is a high neurotoxin. And your nervous system runs everything. In every tissue, you'll find blood, nerve, and lymph. Blood feeds them, lymph cleans them, and nerve moves them. And that's everywhere. And when you get to type 1, I'll tell you what a couple of medical doctors found that should have won a Nobel Peace Prize for this. So let's stay with type 1, sugar metabolism problems, or type 2, sugar metabolism problems and hypoglycemia. These are controlled by the steroid cortisol. And you've heard of cortisol because medical doctors tend to give you cortisone shots when you have pain. A good veterinarian will never give cortisone shots because it weakens the adrenal glands every time you get a shot. One veterinarian told me that if you give a dog a cortisone shot, he'll lose his adrenal glands for 2 weeks. So very important to understand why you don't treat using steroids and hormones or neurotransmitters as far as that's concerned, or digestive enzymes. These are endocrine gland issues, and your endocrine glands will stop making these substances if you take them. Not the way to do it. So the adrenal glands, big glands. The other side, of course, is the steroids. You got neurotransmitters and steroids. So when you don't metabolize sugars properly, your blood sugar is either going to go low or high. Generally, when the adrenal glands are weak, you're going to see a low systolic blood pressure. Your upper blood pressure number is going to go low. Even though we call it blood pressure, you notice there's 2 numbers, a systolic, which is the top number, and a diastolic, which is the bottom number. The top number is your adrenal glands, and the bottom number represents your kidneys. 120 over 60 is textbook. When you go below 120, you're in low blood pressure. And the lower you go below 100, the more serious the problems. You see a lot of the children today, because of our genetic passing of our weaknesses, instead of us learning to strengthen our bodies or our cells, we just pass our weaknesses. So these children today are 70, 80, over, meaning they have very compromised nervous systems. Their myelin sheaths are weak, and therefore a shot of thimerosal or any other neurotoxin can throw them into seizures, ADD, ADHD, all types of problems. So you want to think about health. So the most important thing with sugar metabolism problems, of course, is that you address the health of the adrenal glands. And that is also going to take you into the world of your kidneys and your lymphatic system. Diet-wise, you want to stay on raw fruits and vegetables. You can have some cooked vegetables. Stay away from proteins. That raises the blood sugar. Of course, all starch, which is complex sugar, is going to make your blood sugars high. There's no question, because you're not metabolizing these sugars. The end result of not metabolizing your sugars is not only stored fat, but it's high fungus problems, because sugar starts to ferment in the body, and this creates fungal problems. The fungus family is the fermentation family. They're involved in fermenting of sugars and the like. So very important to make the glands healthy. Make all your cells healthy. You're not fighting a disease. You're fighting a weakness in the glands. And in disease, you're fighting a weakness in the glands. And each generation is weaker. Your parents could have no blood sugar problems, and you could. And it'd still be genetics, because they're just above that line. So even type 2, you want to eat fruits and vegetables. Now, the neat thing about that is it'll control blood sugars, and as you work on the adrenals and get the adrenals healthy, it's easy to get you in a position to where you no longer have blood sugar metabolism problems. So these are real easy to cure. If you want to use that word in terms of disease, it's not a disease. These are cells in your body that are not performing properly, either from their genetic consciousness or from your diet, which has backed up the lymph system. Now let's look at type 1 a minute, because we're inundated with type 1s. They're on insulin pumps and all, and it's just a huge problem that we face here. And there's two reasons for type 1. Type 1 is you're not producing enough insulin to help carry glucose across the cell wall. Now notice I said glucose. It is important to understand that each cell requires carbon and oxygen. Those are the two main constituents that every cell requires to be healthy. And carbon and oxygen is exactly what your car motor uses to run. In our body, when you mix carbon and oxygen together, it creates ATP, adenosine triphosphate, essential for the health of the cell. So in diabetics, especially type 1, it is vital that you get a sugar, which is a carbon chain constituent, into that cell. Well, if you're not adequately producing enough insulin, then you would want to, it makes sense to have a sugar that didn't require insulin. And there is one, and that's fruit sugar. All our diabetics type 1 goes on a fruit diet. You can show where you can go on an exclusively fruit diet, eat a salad, and your blood sugar will go up from the salad because you're not carrying that glucose into a cell. You have insulin production problems. So real serious with that. So you always want to be on fruits. At least you'll get ATP, even if you glucose load a little bit. Because when you break down your fat, you're going to glucose load a little bit. Ketones, this is fat breaking down. Same thing as acidosis. Put yourself on watermelon. Fast on watermelon. Clean these ketones out of you. This is all about detoxifying and regenerating the human body. Now, there was a couple of medical doctors in Canada that discovered that a lot of type 1 diabetes isn't a pancreatic weakness. Now, your pancreas has what's called islets of Langerhans, and they have what's called the beta cells. And the beta cells is where you produce insulin. So when these beta cells are weak, of course, or when they're not thinking properly, if you will, genetics is cellular memories, and when you understand what that means and relationship to yourself, you'll understand that cells' functionability is determined by their genetics, their memory patterns of the family trees. And you can change these genetic thinkings of cells. It's easy to regenerate genetics in the human body. And I think we discussed that a little bit, but maybe we will when we get into physics or we get into electromagnetic energy and intelligence. Because it's real, and it's an uplifting discussion on a much deeper aspect of how life works and how God works. Much deeper than the world of chemistry. So understanding the pancreas this time, not the adrenal glands. However, these two medical doctors discovered that oftentimes type 1 is the nervous system in the pancreas doesn't allow the beta cells to produce insulin. This is very important because I see many, many clients that have type 1 who have no pancreatic problems whatsoever. And then when I look deeper, I find they have weak adrenal glands and they have a neurological problem. They found that these two medical doctors, they should have won a Nobel Peace Prize. This is instrumental in understanding not just the pancreas, but also kidney filtration of the lymph and so many other things, because your nervous system is in every tissue and its ability to make that tissue function is vital. So the suppression of the neurological system, the autonomic system, can create hypofunctionings of cells and the hypoproducing or underproducing of hormones and steroids. And it's just on and on and on. It can be any aspect of the human body, from breathing, like I said previously, to hearts and the ability to open valves, etc., etc. So important to understand that the nervous system in the pancreas that controls the beta cell production of insulin is the autonomic nervous system. And now we're back at the adrenal glands again, which controls sugar metabolism, but also controls the autonomic nervous system. Very important, because if you're trying to work on type 1 and you're just going after the pancreas, you could be unsuccessful. Your success is making all cells in the body healthy, but you particularly always want to focus on kidney and adrenal glands because of the far-reaching aspects of lymph stagnation and acidosis and nerve suppression. Both of those things leads to cell inactivity, cell damage, and on and on and on, all into the world of cancers and all the symptomologies that man experiences. So far, important to understand that a lot of times we are a neurological diabetic. I'll give you an example, and this is an interesting case. A lady came in the other day, 50 years old, and she had hurt her knee, her left knee, and she had had a surgical repair of that, and something went wrong, I don't know, but the surgeon had to operate 3 times on that left knee to get it back in shape again. Well, after the 3rd surgery, she went into type 1 diabetes, and she stopped menstruating. Now, this is very significant. Why? Why after the 3rd surgery would she then have type 1 diabetes and she stopped menstruating? And the answer was what I just led you up to. The answer is anesthesia is a neurotoxin. What it did is suppress the nervous system, the autonomic nervous system, and she couldn't produce insulin properly anymore. She also suppressed her pituitary and couldn't menstruate, couldn't produce FSH. So this suppresses head to toe, even the central nervous system. Go back to Michael Jackson again. So we have to wake up to what neurotoxins are, and they're everywhere. They're pesticides, herbicides, certain perfumes, deodorizers for bathrooms. The list is long. Be careful. You could be eating a nice big salad in a restaurant and go into an anxiety attack and shortness of breath because you forgot to clean the pesticides off of these vegetables. So the more sensitive you are neurologically, you will become very sensitive to these aspects. So when you're type 1, you want to always work on the kidney and adrenals. You always want to work on the lymphatic system, but you also can work on the pancreas. It's okay. They gave this lady a transplant of the islets, and of course they didn't take. Now they gave her a transplant of that. They put this lady through hell, and now she's came to us, and now she's rebuilding tissue again. She's fixing her nervous system, and now she's back normal again. But how interesting is that to understand that the nervous system can play a role in that? Type 1 diabetes should always be on fruit. Fruit. If you go up a little higher in blood sugar, just observe that. You'll probably glucose load for a while as you break down the fat in the body. And if you're having vegetables with fruit, you might see an upswing of glucose. But ultimately, you will see your glucose levels drop, and your blood sugar levels drop. And when you do, you be careful what you're taking. If you're on insulin or macrophage or some type of hormone there for that, you must be very careful, because it's easy to control blood sugars. And it's not too difficult after that to make the cells healthy again and not have that problem. Yes, type 1 is a more genetic problem, no question about it. You notice most people that have type 1 are younger. However, this one case of this 50-year-old shows you just that neurological compromising of the nervous system. So be healthy. Use herbs to help with this. Herbs are great at helping to improve the function of the adrenals, the kidneys, the pancreas. But always keep your diet to fresh fruits and vegetables. If you have to have some cooked vegetables, okay. Stay away from protein. Stay definitely away from fats. When you have blood sugar problems, you never do starch. That's complex sugar. Starch is polysaccharides, meaning multiple sugars. Fruits and vegetables are monosugars, simple sugars. You have to have a sugar. Can't starve your body for a sugar, because when you damage cells, this is going to become more serious. Okay, so thank you, and stay tuned. We'll get into more problems as we go along here and more conditions that you have. And so thank you for staying tuned. Thank you.